Hi everyone, Dr. Luke Peterson here, physical therapist with a knee replacement therapist. In this episode of the Need to Know Show, I'm going to address the question, should my knee replacement exercises be painful? So of course this is a very popular question and you might get some varying responses depending on who you ask and who you talk to. So it's really it depends is the answer. So first of all, I'm going to say the phrase no pain, no gain is not something that we follow when it comes to knee replacement surgery and recovery. You don't have to get to a point where your exercises and your range of motion exercises or whatever they may be are causing significant amounts of pain and discomfort and flare-up of symptoms and everything else in between. It's not a prerequisite or a necessity that you get to that point of pain and discomfort with your exercises. Now, I will say that you're going to probably have some pain and discomfort. You're probably going to have some pain, especially early on with your knee replacement exercises. That's kind of the nature of the beast and what kind of comes with the territory, unfortunately. But we want to find that happy medium. We want to be able to stress the body enough that we're making improvements to the soft tissue, to the muscles, improving range of motion, improving flexibility, improving strength. But we don't want to stress the body to such an intensity that it's going to cause a flare-up, that it's going to aggravate your symptoms, increase your pain so high, increase your swelling, increase stiffness, that maybe the next day you're not even able to do your exercises, or you're not even able to walk hardly, or it sets you back for a couple days or a whole week even. We want to find that medium where we're stressing the body enough to make some improvements and get some benefit, but not so high that we can cause those flare-ups and cause that setback, so to speak. And so it's all about guess and check, honestly, in simplistic terms. We do some exercises, we do some activities, we see how your body tolerates it. We want your symptoms, we want your pain to recover to baseline level. So not necessarily to a point of having no pain or no symptoms, but we want it to be no worse than what it was than when you started physical therapy or that day or started that session, or no worse than when you started your exercises before you started your exercises that day. So we want it to recover, you hear different times. You say maybe within 10-15 minutes of an exercise. You hear maybe within a few hours after your physical therapy or exercise session, you want the symptoms to go back to baseline. If you're going to bed that evening and your symptoms are still very high, or you're waking up the next day with increased symptoms, significantly increased symptoms and pain, then we obviously did too much and we'll have to make that adjustment. And that's something that we're constantly doing. Your body is going through different phases as it heals and recovers. Early on, it's probably going to be very sensitive. There's a lot of pain, there's a lot of swelling, inflammation going on, and you probably won't tolerate as much activity. As you move into that second phase of healing, that 1 week to 6 or 8 weeks or somewhere in that time frame, you're going to start to tolerate more and more, and we're going to progressively build up the intensity of what we're doing. And then as you progress into that next phase, we'll follow the same guidelines, and hopefully over time you'll really start to tolerate more and more exercise and activity. So to summarize, is it normal to have pain with your exercises? Absolutely. Should you have pain? You don't have to have pain. If you don't have pain, that's awesome, and consider yourself lucky. But it is also common to have some pain, and not a bad thing, and not something that you should be concerned about. What we should be concerned about is if the pain rises to a super high intensity, that it lasts into the night, lasts into the next day, or that it causes new symptoms and doesn't allow you to tolerate your exercises, activities the next day or the days afterward. I hope that gave you some clarity to this question. Please be sure to leave your comments and questions below and I'll be sure to get back to you. Click that subscribe button if you're interested in videos similar to this, addressing all things related to knee replacement surgery, exercises, frequently asked questions, everything else in between. Thank you for watching.